The second phase of government's COVID-19 vaccine kicked off with some delays due to faulty registration systems. There's also a backlog in the number of healthcare workers who still have not been vaccinated. If that isn't enough, there are still those people who seem to be hesitant about taking the jab. Junior researcher from UCT's Development Policy Research Unit, Tim Köhler, joins me now to discuss vaccine hesitancy and the findings of the Wave 4 of the National Income Dynamics Study. Tim, thanks for your time. We appreciate it. So, of course, we still have government desperately asking the elderly to register for this round of the vaccination rollout, and that's not happening. Does that have much to do about vaccine hesitancy at all?
Hi, thanks for having me. Yes, it might indeed. In using this data in our new study, we find that about 71% of South African adults are actually willing to get a COVID-19 vaccine if one were available to them. Now, most of these adults respond to the question, the vaccine was available, I would get it. Most of them strongly agree. A smaller proportion somewhat agree, but a relatively small proportion either somewhat or strongly disagree. And we observe a little bit of uncertainty as well. But of course, we see a lot of differences in vaccine intent, so to speak, across different groups of individuals. However, with respect to older people, we do find that intent is relatively high. We actually observe more vaccine hesitancy amongst the youth.
Yeah, that's interesting. So let's break down the different hesitancies you're seeing between groups, because I see that the survey found that 42% of Afrikaans home language respondents were vaccine hesitant, and that was much higher than the national average.
Yes, yeah, sure. So looking at the survey results, we know that overall about 71% of results, 71% of adults would get the vaccine if available to them. When we look at it by gender, we see that men, somewhat surprisingly, are slightly more likely to intend to get a vaccine relative to women. And then older individuals, as previously discussed, youth, only 63% of those aged between 18 and 34 are willing to get a vaccine, as opposed to about 73% of those older than 35. We see some variation by self-reported racial population group, but all groups are relatively high, and we do observe a clear education gradient. Notably, those with less than a post-secondary education are less willing to get a COVID-19 vaccine if available to them. Of course, we see a lot of differences in intent across home language, notably Afrikaans, more hesitancy amongst those who have Afrikaans as a home language, and we particularly see some concentration of hesitancy in the Northern and Western Cape provinces, where we know that Afrikaans is, of course, a home language to many.
Yeah. So outside of the vaccine hesitancy, let's talk about the education system and how learning has been affected. What are you finding there?
Sure. Well, I actually wasn't involved in any of the research with respect to education. The research we were involved in particularly looked at the determinants or the correlates of vaccine hesitancy and how it varies across different groups of individuals. But if anyone is interested in that research, you can look at the NIDSCRAM website.
Yeah, I'll just read a part of that research. It says in 2020, South African primary school children in no-fee schools have learned 50 to 75% less than what they usually learn. And that's, of course, because of schools closing. So let's continue then, since you're focusing on the vaccines, whether or not government can do anything else to encourage people to get vaccinated, or are their minds made up from what you're seeing?
Sure, yeah. Well, I think that we all think that vaccine hesitancy or intent is likely to vary significantly as the pandemic progresses, as well as the rollout of vaccines continues. So importantly, this data that we base these results on was collected right after the second COVID wave, but prior to the pause of the Johnson & Johnson vaccine, which was paused with respect to concerns about blood clots, which we know are extremely rare. Of course, it seems that one is more likely to develop blood clots if you get COVID than if you get the vaccine, for example. So we do see in the research, we also ask respondents, well, amongst those who are hesitant, what is the main reason why? And we see that the dominant concern relates to worry about side effects. Specifically, about a third of those who are vaccine hesitant cites that they are so because they're worried about side effects. We also see some hesitancy relating to them not believing that it is effective, about 20% of the hesitant, as well as individuals who are generally against vaccines in general. Notably, we see a very small proportion of vaccine hesitant people who are hesitant because of reasons such as they don't trust the government, or they cannot afford the vaccine, or do not have time, which is a notable finding. But of course, we can use these reasons and specifically see how the main reasons vary across different groups of individuals to sort of target policy messages to them to ensure that we combat any sort of vaccine disinformation as we can. For instance, we do note that a large proportion of vaccine hesitant individuals cite trusting social media to a large extent for as a source of valid information. So government or policymakers ought to consider taking advantage of this trust to counter any vaccine disinformation. It could prove to be a really cost-effective way to convey accurate and updated information. And we can also use it to incorporate methods into other communication channels that favor this group to maximize reach and intensity.
All right, thank you so much for your insight. Appreciate it. Tim Köhler from the University of Cape Town.